Hey everyone, welcome to the Autoimmune Dietitian YouTube channel. My name is Annie Rubin. I am a registered dietitian and I run a private practice focused on people suffering with autoimmune and inflammatory disorders. So in my work with my clients, I help them implement a personalized nutrition roadmap designed to improve mobility, concentration, give them their energy back, and help them live the lives that they should be living. So if you're watching this kind of recently, it is March, and March is Autoimmune Disease Awareness Month. So each week this month, I will be highlighting a different autoimmune disease, and this week it is rheumatoid arthritis. RA is an autoimmune disease that is very close to my heart because I've been living with it for almost 15 years. So today we're going to talk about what this autoimmune disease is, how it's diagnosed, what treatments are out there, and then what diet and lifestyle things you can do to help reduce the symptoms of this disease. So before I jump in, I just need to attach a disclaimer to this video that the information in today's talk is not the substitute for the diagnosis, treatment, or care of disease by a medical provider. This is for informational purposes only, so please consult your qualified health professional for any changes to your medical care. So what is rheumatoid arthritis? Rheumatoid arthritis, or as it's abbreviated as RA, is an autoimmune disease where the immune system attacks the joint linings and causes joint pain and inflammation. The tissues surrounding the joints, which is also called the synovium, produce a fluid to help the joints move. So when this tissue is destroyed or when it's inflamed, it causes pain in the joint area and it makes it difficult for someone to move their joints. So most people with RA experience pain in the hands, knees, and ankles, and it usually affects both sides of the body at the same time, which differentiates rheumatoid arthritis from other forms of arthritis. Approximately 1.5 million people in the US have RA, and women are 3 times more likely to develop RA than men. Additionally, most women develop RA between the ages of 30 and 60. So the other issue with rheumatoid arthritis is that it can affect other areas of your body and not just your joints. It can affect your lungs, and it can also increase your risk of cardiovascular disease. Because RA also affects mobility, it can make it difficult for people to move their bodies, which can lead to weight gain, which then places even more stress on the joints. So as with any autoimmune disease, getting a diagnosis can be a huge challenge. With RA in particular, you need to see a rheumatologist to get a thorough physical examination. He or she will look at your joints for swelling, stiffness, and even bumps under your skin. There are some blood tests that can help uncover a diagnosis, but they're not always very conclusive, which is frustrating. So one of the first sets of blood tests that a doctor may run are the inflammatory markers that include erythrocyte sedimentation rate, or ESR, and C-reactive protein, or CRP. ESR is a longer-term indicator of inflammation, and CRP is a more acute, short-term inflammation marker. So if one or both of these is elevated, it can help point to a rheumatoid arthritis diagnosis. The other blood test that is commonly run is called a rheumatoid factor, or RF. RF is an antibody found in approximately 80% of people with RA. So if you test positive for RF, it's likely that you have rheumatoid arthritis. Your doctor may also check antibodies to anti-cyclic citrullonated peptide, or it's abbreviated as anti-CCP. A positive anti-CCP is found in around 60 to 70% of people with rheumatoid arthritis, but they are also found in people who do not have rheumatoid arthritis. So again, it's not a very conclusive marker. However, people who have high anti-CCP levels and have a confirmed diagnosis of rheumatoid arthritis they have what is called a seropositive RA. And those with low to no anti-CCP markers are called seronegative RA. With seronegative RA, it can take longer to get a diagnosis because rheumatologists also have to rule out other forms of arthritis, such as psoriatic arthritis and gout. If your rheumatologist may also take x-rays or MRIs of the affected joints, imaging will help identify erosions or places where the ends of the bones are starting to wear down. Imaging also helps track the effectiveness of treatments and or progression of the disease. So it's really important to always keep copies of your imaging. So in case you switch doctors, you have kind of, evidence of your disease progression and how it's been going over time. Okay, so what are the treatment options for rheumatoid arthritis? So with any treatment, the goal is to stop joint destruction, reduce inflammation, and achieve the lowest possible disease activity, and ideally put the disease into remission. So there are three main drug classes to help achieve these goals. They are your non-steroidal anti-inflammatory agents, or NSAIDs, corticosteroids, and disease-modifying anti-rheumatic drugs, or DMARDs. So NSAIDs are used to reduce acute inflammation, but they do not protect the joints from ongoing destruction. They're usually used in conjunction with other medications for relieving pain, especially during an active flare. The problem with NSAIDs is they can be tough on the gastrointestinal tract and should not be used long-term. Corticosteroids include prednisone, which is the most common form of a corticosteroid, and they're really one of the most common anti-inflammatory medications used for rheumatoid arthritis. They are typically used at the onset of diagnosis to quickly reduce inflammation, and with the implementation of DMARDs as a bridge until the latter starts to work. Prednisone should not be used long-term either, as it can deplete calcium in the bones and cause insulin resistance. DMARDs is the last class of drugs that can actually change the disease course of rheumatoid arthritis. So there are a number of DMARDs to choose from. The most commonly used one at the onset of rheumatoid arthritis is methotrexate. Methotrexate interrupts inflammatory pathways, which helps reduce inflammation and prevents joint destruction. However, there are a number of side effects with methotrexate, including fatigue, liver toxicities, headaches, and low folate levels. So typically, doctors will start with methotrexate, and if it is not found to be effective, they will switch to another DMARD, and there's like a long list of things to choose from there. Okay, so in terms of diet and lifestyle, there are a number of studies on the effectiveness of diet on rheumatoid arthritis, but with any nutritional studies, it's really difficult to reach a consensus on what is the most effective diet to support RA because everyone is different. So one kind of specific diet doesn't always work for the next person. So in general, anti-inflammatory diets work the best, which include some of the familiar dietary patterns like Mediterranean, vegetarian, vegan, and even a plant-based or plant-emphasized paleo diet. In addition, there's also a high probability of food sensitivities in the rheumatoid arthritis population, so figuring out what you are sensitive to can really help lower inflammation and disease activity as well, which is what I do with my clients. Figuring out food triggers is a really big part of my practice and my ability to stop inflammation very quickly. Stress is also a major trigger for rheumatoid arthritis. I know for me, I experience more joint pain when I'm dealing with a lot of stress. So it's important to understand how your body processes stress and what techniques you can implement to become more resilient to stress. And that might include therapy, meditation, gentle movement, and/or yoga. So today we talked about rheumatoid arthritis, we talked about what the disease is, how it's diagnosed, what treatment options are available, and then we touched briefly on diet and lifestyle. I have a lot more information on my website and on my blog about rheumatoid arthritis, and then also in my Instagram and Facebook feed. So please follow me if you're interested in learning more about that. But thank you so much for joining me today. If you liked the video and you want to, learn more, please hit the little subscribe button. These come out around every week or so. And I also, do live videos every week on Instagram, so you can look for me there and check out my blog for a lot more information. So thanks for joining me today, and join me next week for another interesting discussion on autoimmune diseases, lifestyle, diet, and how that all works together. Thanks.